Hello, friends. Welcome to this educational series on aphasia post stroke. Today, we are going to understand and learn about Wernicke's aphasia. What exactly it is, why it happens, and what are the simple home care strategies that you can incorporate for your patient at home. Let's understand that. Friends, Wernicke's aphasia is also called as receptive aphasia. In this condition, what happens is, even though the patient who suffers from stroke is able to speak fluently, but whatever the words that they use or say doesn't make sense, even though they are grammatically correct, but if you have to make a meaning out of that sentence, it's genuinely very difficult. This particular condition happens when there is damage to the Wernicke's area, which is located in the left hemisphere of your brain. To be very specific, this area is located exactly in the brain area, which is above the ear. This particular area in the brain is responsible for two most important things. Number one is processing of information, which means that whatever the brain has captured as an information from the surrounding or is from internal or is from within is processed, is thought over and has brought to the Wernicke's areas for processing. And that's where the processing doesn't happen in the right way. At the same time, it's also responsible in understanding the language, which when affected affects and leads to Wernicke's aphasia. Mostly, the Wernicke's aphasia happen after stroke, but it can also happen following a brain injury or else a tumor or else infection too. People who suffer from Wernicke aphasia sound very normal, or else you can say their speech is very fluent in terms of grammar, in terms of intonation and in terms of rhythm. But when it comes to logical sense, it lacks. Whatever they say just doesn't make sense. It looks like some made up words jumbled together and just spoken. They usually use substitution words, a lot of proverbs just to explain what they are trying to say. Unfortunately, they themselves are not aware that they are not making sense. This makes the conversation far more confusing and frustrating both for the caregiver and for the patient. That's why people with Wernicke's aphasia are usually misunderstood and are not able to learn the skill set of language in the right manner. However, Wernicke's aphasia has got some other symptoms. These symptoms are understanding what others are trying to say. They will also face trouble with reading and writing, as similar as they have trouble with speaking. They have trouble in repeating phrases and following the conversation, as well as they usually struggle to find the right words. Despite all these challenges, intelligence is well intact. Thinking skills are also preserved. What's the treatment for Wernicke's aphasia? Well, like any other speech disorder, Wernicke's aphasia also require a proper speech-language therapy. Speech-language therapist helps the patient to improve his communication and comprehension over time. Therapist uses different strategies and help patients to understand words, languages more effectively and remove the supplement language that patient uses in the incorrect manner. Therapist uses multiple tools like gestures, communication boards, etc. to encourage right communication patterns and activities so that patient can communicate well with their caregivers and their loved ones. Majority of people gain significant improvement in their speech after right kind of speech therapy. Especially the sooner it starts, the better is the outcome. But here are some important strategies that can be practiced at home to improve speech of people who are suffering from Wernicke's aphasia. Let's understand what are these. Number one, try to speak with your patient in a slow and steady pace. Don't hurry words and use simple words. Make sure your sentences are short and simple and to the point. Make sure to avoid complex grammar and passive voice in the sentences that you are using. Use concrete and familiar words and avoid using pronouns while communicating with your patient. Provide context before discussing any activity or item. For example, show an object before starting to speak about it. Next is get your person's attention at place before starting the communication. If the patient is not attentive and you just start communication, then it might not work. Use gestures, facial expressions, visual aids like picture, communication board, written words to support spoken language. Break down complex information into small, manageable and understandable commands so that patient can understand and follow it in the right manner. Encourage the patient to ask questions and repeat the information in their own words to ensure proper understanding. Reinforce comprehension by summarizing and repeating whatever was communicated or said during the conversation. Be patient. Give extra time to your patient without interrupting. Establish consistent routines to avoid confusion and overwhelm, thus improving the predictability. When you will incorporate these strategies in your day-to-day practice, you will observe that you would be able to manage the condition well. Having said that, stroke is not just about aphasia. There are a lot of other multimodal impairments that come on the way. Whenever you observe that your patient has got these kind of issues, working with the right kind of team or therapist is going to help you. At HealthQ Rehab, we have a multimodal approach where we combine therapies like speech therapy, physiotherapy, cognitive behavior therapy to help patients achieve their best outcomes. We are facial rehabilitation therapist who works towards improving any impairment that's related to head, neck and face. So if you feel that you need help, you can reach out to us. The details are mentioned in the description box below. I hope this video was helpful for you. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. On that note, I'll end this video here and I'll see you in another video. Thank you.